Normal periods can be different from person to person, but there are a few parameters that we like to keep in mind as a normal range. So we usually start by talking about how long a menstrual cycle should be. The menstrual cycle is measured from day 1 of a period to the day right before the next period. On average, a menstrual cycle lasts anywhere from 24 to 38 days, and it varies from person to person. The total amount of blood loss from an individual period can be anywhere from 3 to 5 tablespoons, but keep in mind that's total throughout all days of bleeding. Not everyone gets cramps with their periods, but usually when people do get cramps, they're going to be in the day or two before the period starts, and then again in the first few days of the period. You can feel cramps anywhere in the lower abdomen, in the groin, sometimes in the buttocks, and even in the back. It's normal for a period cycle to be abnormal in the first couple years of having a period and in the years right before your period is about to end, so around menopause. But there are other things that can also throw off a period. The most common concern for people is pregnancy, but in fact, there are many more things that can throw off month to month someone's regular cycle. They include things like increases in exercise or excessive exercise, not carrying enough body weight or significant weight loss, mental stress or anxiety, and physical stress or things like illness or surgery. Usually these should resolve within a couple of months, so if they're lasting any longer than that, it's worth talking to a doctor. Many people report that when they live with other women or other individuals with periods, that their periods tend to sync up. While this can be a pattern that is noted, there's actually no real scientific evidence behind that. It just is usually more of a coincidence. The whole point of a menstrual cycle is to prepare a body for carrying a baby. And so what's happening is with a period, the uterus is shedding its lining to sort of prepare a fresh, fluffy bed of tissue for a maybe baby or a fertilized egg. Usually about halfway through the cycle, when ovulation happens, if the body doesn't detect that a fertilized egg has been implanted, then it prepares to shed that lining of the uterus and make a new fluffy bed for the next round of a maybe baby. The period itself is essentially the flushing out of some tissue of the uterine lining and some bleeding. Periods are a very normal function of having female anatomy. The reason that we like to talk about a normal amount of period loss, though, is because some people do have bleeding disorders or clotting disorders in which you lose more than normal period blood. So if you're concerned that you're losing more than 3 to 5 tablespoons every month, certainly talk with your doctor, but having a period is a very normal part of having a uterus. Endometriosis is when uterine tissue is found outside of the uterus in other parts of the abdominal cavity. And while it is a concern for many individuals who experience very painful cramping, there are certain things that you can look out for to be a sign that you might have endometriosis or that you just might have very painful cramping. Oftentimes, endometriosis cramping comes at times that don't sync up with a period. If you have very painful period cramps, it's unlikely that you have endometriosis. If you have cramping outside of your normal period time, then you should talk with your doctor. I hope you enjoyed this video. If you want to learn more about your body and sex, subscribe to our channel, and we'll post videos like this regularly. If you have any questions for us, leave them in the comments section. Thanks for watching.